So then once you find those movements that are bothering the most, you tell them to avoid them like the plague.
Oh, yeah,
right?
man. Don't ever bend over.
Yeah.
You'll bulge your disc and pinch a nerve and yourself.
Welcome, everyone, to another episode of Coaches on Couches.
Bing slouches.
Today, we've got Clay Jones,
Hello.
Sara Michael on the couch today from 901 PT. We're going to be talking about back pain.
Back pain. Pain in the back.
Yeah.
We'll save neck for a different time.
Yeah, I thought you were going to break into song here. I was counting on it.
Low back pain.
We'll spare the listeners my singing.
Yeah. So we're going to go over some of the common causes, treatments, some of the myths, all that kind of stuff surrounding back pain in regards to endurance athletes today. So before we get to that, I'm Coach Dale Sanford.
I am Coach Bryant Funston. We are the co-founders of BPC Performance Coaching, where we specialize in helping time-crunched athletes optimize their busy schedules so they can maximize their athletic performance. You can find out more about BPC by going to buildpeakcompete.com, checking Facebook and YouTube at buildpeakcompete, all up on that Instagram at BPC Performance, and wherever you get your podcasting from.
Yeah, Face for
Coaches on
Radio.
Couches? I don't know. Whatever that is, search for it.
I get it from my phone.
Yeah, exactly.
All right, so we've got Clay and Sara on the couch today, or they're actually on the chairs. So, but first of all, guys, just tell us kind of your background. You know, two physical therapists. You know, where you at in life? Why did you choose physical therapy?
Where am I at in life?
Do you have to go to school for that?
Existential questions.
You got whatever philosophical things you've got flowing through your head.
tell you, Dale.
I'm in
go
midlife
with
crisis
it.
right now. I'm 40, so... Yeah, I'm Clay, and I'm Memphis born and raised.
Yeah.
Same for Sara.
Yeah.
I went to physical therapy school. I grew up here at ECS. I was an incredible athlete, kindergarten through third grade.
Ooh,
And then my athletic abilities started tanking when everybody got taller than me and bigger than me. But I've got a really big, tall trophy when I was like a third grade. We were undefeated.
there we go.
anyways, I'm gonna go
Which
back to
sport
that.
was this?
Soccer.
Nice.
Yeah, played sports throughout school, basketball, baseball, soccer, did some cross country for a little bit, and then got into high school, played a little bit of soccer, was good at first, and sat the bench. And then I played into college just for fun, that kind of stuff. But went to PT school here in UT in Memphis, graduated in 2008. We got our doctorate of physical therapy. When did you graduate, Sara?
2015.
Yep. After graduating 2008, I went out to Seattle to do a sports medicine and spine fellowship. Was out there for several years, and then moved back to Memphis because this is where I'm from, and I have 4 kids, and we needed help. I was like, I can't continue to do this on my own. My wife is amazing, and we have a lot of family here in town, so we wanted to come back.
Yeah.
So I did that, and I've been a physical therapist, different clinics throughout the city, and I've had great experience at all of those. But then about 5 years ago, I decided I kind of want to do my own thing, and just really wanted to provide a different experience. And in some part, I wanted to really focus on the more active individual.
Yep.
Or at least I wanted to get people more active. One of my mentors would say, if you have a human body, you're an athlete. So I don't want to say at 901 PT, we only treat like high-level athletes. We do see a lot of that. But we want to encourage anybody who wants to move to be moving. Mm-hmm. So I started my business because I really wanted to focus on that. And so we can really encourage people moving and doing it for fun and doing it at high level. So it's a little bit about me. Dr. Sara.
Like you said, I'm from here too. So I grew up here. I was a competitive tennis player growing up. So I played pretty much tennis from 6 to 18. That was a lot of tennis. And that was pretty much year round. So by the time I was 18, I didn't want to look at tennis.
Oh, yeah.
You say, do you still play tennis?
No, I don't.
I didn't know she played tennis, and I worked there for a while.
Yeah. Yeah.
She would not even speak of it.
It was a lot. I was very burnt out.
I talk about
in
my
the last-
childhood. Like,
the last
I
few
was an
years.
incredible soccer player as a second grader.
Yeah. And so, but that was kind of my sport background. And in terms of, I always loved the outdoors. So my dad started taking me backpacking through the Pacific Northwest. So I started at an early age. I think I went on my first trip at 11.
Oh, nice.
And then by, I think I was, 18 or 19, and did my first, we did a glacial ascent, like a mountaineering ascent. And so that's kind of, I got into how, I guess I got into more of an endurance side of things. I still prefer kind of trail, off-road, type stuff. Obviously no large mountains, but that's largely geographical.
Yeah, exactly.
So now, I don't know, a few years ago, I had kind of run on and off, after I stopped playing tennis. Running was just kind of something I kept up with. And I did that kind of lackadaisically in college, and went to PT school here. Got my doctorate in 2015. Worked a few different places, and then actually reconnected with Clay, and that's how I kind of came on board. And that's when then I started really kind of getting into more, specific endurance training around that time.
Both of us in our prior jobs, the work-life balance wasn't there.
Right.
And one of my favorite things when I started this 911 PT was like, what's going to be best for patients, what's also best for us as a team. And we really emphasize, if we're going to do this, we want to practice what we preach. And so all of us have really put more time into our own athletic and just enjoyment, leisure activities and that kind of stuff, but particularly doing the things also that we treat. That was something that I've always grown up playing sports, but I was never consistent in anything. 4 kids, craziness, doing my fellowships and stuff. But then when I started this, I was like, I've got to know more and more about it. And so I've got more into like kind of the CrossFit style of lifting and training, Iron Tribe, different places I've been just throughout the years. And I started getting more into running with 5Ks and stuff. And then this past year, I ran my first half marathon at St. Jude. So I was like, I've got to do more longer distance stuff. And so I did that this past year, and that was awesome. And have continued to keep working on that running this year. But Sarah in particular, when she came on, she really just got into the running. And it's just been awesome to see her like bloom in that. Like she's just really taken off. It's been fun to see how she's been doing that. And all the therapists at our clinic, whether it's Olympic weightlifting or endurance running or some cycling, different things like that, we just all have really wanted to, practice what we preach and get active.
Yeah, definitely. Yeah, I think I've said this a million times, is so like some of the best coaches out there are the ones that can like show you what to do correctly, versus just explaining it, or just have the wealth of or a background to where, however this athlete or this patient is going to understand it, you have the ability to either do it visually, telling them how to do it, showing them how to do it, that sort of thing. So no, that's in our opinion, my opinion, that's a strong suit.
Yeah, for sure.
I don't
even
like
going through it yourself. Like going through training is a lot different than prescribing training.
Yes.
So if we're just sitting on the sidelines and writing up plans for our athletes, but never really experiencing what does it mean to train for 10 hours when you have 3-4 kids, and a job and a business, and that's a whole level of stresses that unless you're going through it also, you don't really get the full picture. And human bodies, as you guys know well, are complicated things.
Right.
There's a lot of interconnected parts, and then when you start adding the brain into all that and psychology and everything else that can be going on, a massive difference there.
I got hurt. Another thing we have a lot of experience is we try to hurt ourselves in as many ways as possible.
Please tell me it was your back. This will be our segue.
No, really. I had a stress fracture in high school. Was told, it's just your muscle, don't worry about it, and then had chronic back issues for about 10 years. So I've had a lot of experience with that. But yeah, when you get hurt, I've been able to, whether it's my knee, when I started running for the first time a few years ago and doing too much too soon, you learn a lot of stuff. Hurting, tore part of my adductor muscle, squatting heavy last year and having to come back from that stuff. So yeah, like doing it, you realize, these things happen. And you learn a lot of how to then communicate, relate to your patients, and it makes a huge difference. For sure.
For sure.
And you feel like what things am I okay training through? I mean, I've had things that I'm like, I'm not stopping. Like, I'm okay. It doesn't mean I don't feel it, but I know, like, So understanding what's like to train through something, and then also understanding when that red light hits. When I have had the ones that have sidelined me, and I've had ones that I'm like, I'm plowing through, right? So it's you can experience that. And then, that way, I mean, like you can relate to your patient.
Oh, for sure. And
truly it's fun. Like it's just fun you doing these things. And then you go there and you watch other people succeed at the same time, right? Like, when I've done races and that's a big victory for myself, it's fun to watch the people cross the finish line that, you've played a part in their victory, and getting able to celebrate that with them.
Had a lot of patients pass me the Buffalo races.
Is fun.
I'm glad I helped her out. Good job.
Most of them are way better at me than me at things.
That
now, if you're in the same age group as them, does that change your treatment protocol? Do you sort of sabotage
just stay down
or
here,
no? I do not recommend you doing the races weekend.
Yeah, if you're in the age group between 40 and 45, don't come see me. Go see Sarah.
There you go. Trade off. Right?
Well, let's sort of jump into the back pain stuff. Right. So something when we were chatting with y'all about coming on the podcast with us, we were like, what is one of the things you see the most with endurance athletes? Low back pain is something we see a lot. Some of our athletes end up going through it. I know you guys see it a lot. So just kind of dive into it. Back pain can mean a lot of things. So what are some of those common causes? How do you identify if someone comes to you and says, hey, my low back hurts? What do you both end up doing from there?
Yeah, I mean, like you said, low back issues are the most common thing that we see for anything, whether you're sitting on your butt too much or active athletes. It's just a really common thing. I think a lot of it does come back to the fact that in our society, we do sit so much. And that can be a damning thing, if you will, to our low back in particular, because it sets up bad habits and bad patterns. So when people come in to see us with low back pain, it's a gamut. Low back pain is been studied so much, and we always try to pinpoint one particular tissue or structure, and it's one biomechanical fault or this one muscle, and it's just not that simple.
Like it's one link in a chain that's bad.
It's convoluted. For us, it's also not just the biology, the biomechanical side of things. For us, we really focus on the biopsychosocial. So that's a way of seeing things that has really changed how I treat in the past decade. The bio being, you have to look at the biology, you have to look at what tissue is going, what muscle, what joint, what the biomechanics of the movements. But you also have to look at the psychology of an injury. How much is someone afraid of their back? Have they been told, you've got a disc bulge, you can never run again? Or they think that they're wearing the back the more they stay on the bike. The social side of it, hey, I'm used to riding with a group of individuals and now I can't because I have to stay at home because I can't ride, and how much that affects them and affects their psychology, or the fact that they see themselves as this high-level athlete and then they get hurt. Like all that gets wrapped up into someone's experience of pain, almost the low back more than anything else. Because it can be hard to figure out exactly what's going on. And so you have to so when we see people when we have athletes come and see us, we start off with this bigger approach. Okay. Look at the whole system, look at the whole person, not just let's find that facet joint or that hip that's tight. We're going to do that due diligence too, but we have to look at the biopsychosocial factors, their nutrition, their sleep, their stress, their fear of the pain they have coming into. So it's a lot that you have to look into for low back to really tackle a true, particularly if it's a chronic back issue. Yeah. If it hurts, if it's something short and acute, that can be pretty straightforward. But if it's a chronic back issue, that can be a lot harder you have to kind of dive through all that stuff.
But even still with that short, sorry.
I would say I'll be the first to tell you that long-term endurance athletes are head cases. They're all head cases.
Yes, they are. That is true, Dale.
We are all head cases.
Yes, we are. Yeah.
There's a lot there, but I think that even those people with that short-term, that acute scenario, right? Like how they're treated initially shapes if they're going to end up in that chronic boat. So if you treat that acute thing really well on the front end, there's such a large implication of like what you're potentially saving them from, in terms of it turning into a chronic issue.
Anybody coming to us, particularly an endurance athlete, with a back issue, we're always going to start with, well, how can we keep you moving as much as possible?
Yes.
We're not going to sideline you.
We're not going to sideline you. There's some instances when I hurt my back lifting heavy a couple years ago. Yes, I had to sideline myself for about a week where I just was not moving well. And I was going through a whole lot of movement-based stuff that was rehab things. I wasn't sitting on my butt and just hoping it would heal and taking medication. So I was doing a lot of movement-based stuff, but I couldn't go running. I needed to give the tissues some healing time, let that calm down. And I couldn't go lift weights right now. So I had to sideline myself for a little bit, but I'm talking like a week or so. But as soon as possible, even during that week, what are other things we can be doing to keep you moving? Because that really does dictate someone's healing, is if you get them moving as soon as possible. And speaking of myths that we'll probably get to later, there's this myth that particularly with low back, it can be there's so much fear around, oh, I've got shooting back pain. Maybe it's going to my leg. Don't move. I'm going to pinch a nerve.
It's a nerve. Yeah, exactly.
Now I'm, it's my back's going to hell in a handbasket. And so we don't want to move. There's so much fear. And like I say, no, we've got to really get you moving from the beginning, whether it's a joint issue, a muscle issue, a disc issue, a nerve issue, which we tease through. We have to find ways. What is that movement approach that we can take to get you moving? So as physical therapists, we look at we do focus on the specific issue, what's causing the pain, but it's more about what is that movement approach that we have to take to. That's the real key for figuring out low back pain. It's what movements are they going to respond best to?
Gotcha.
That's the real key.
And so that is something when they come in, say it's day one, are you going through like a questionnaire where you're trying to get the full roundabout of what the person is, what their lifestyle's been like, that psychosocial side of things?
Yes,
Yeah.
so.
And then going into more of a movement analysis with them?
You start off with we do an in-depth subjective history. So we're going to spend, particularly if it's chronic, we're going to spend 30 minutes, 45 minutes talking sometimes, because we really want to figure out what started it.
Yeah.
Did this start 10 years ago? What's your history? Tell me about your nutrition. Tell me about your sleep. Tell me about your stress. Tell me about the prior treatments that you've had, MRIs that you've had. What do you think about that? Because we're listening for how they feel about their back to assess those psychosocial issues. But then the bio part of it, we need to figure out, is this someone who is going to respond better to being for endurance athletes? Do we need to keep them on the bike? They're going to respond better to that versus running. Some back issues like, no, that's flexed sitting position in the saddle for too long is going to bother it. Hey, let's keep you running. Let's get you swimming. So we're listening at first for what movements, what positions bother them the most. And then that sends us down the pathway of, now let's take you through a movement exam. Gotcha. And we're going to look at their lower back. We're going to look at their mid back. We're going to look at their hips, their knees, their ankles. We're going to test, from the full spine, particularly for athletes, into the legs. We're going to check so many different things, particularly if it's a chronic issue. You have to look above and below the joint. In physical therapy, we call it regional interdependence. The different regions all depend on each other. Yeah. They're interdependent. So particularly with the back, you got to look at the hips. You've got to look at the mid back, the thoracic spine. All of that goes into the bio part of really getting into the heart of the different causes of low back pain.
So then once you find those movements that are bothering the most, you tell them to avoid them like the plague.
Oh, yeah,
right?
man. Don't ever bend over. You'll bulge your disc and pinch nerve and yourself. So
go see the ortho.
Right. It is more about, I think a key there is instead of thinking rest, right? It's more about optimal loading. Like that's kind of the sweet spot of what you're looking for, is you're looking for ways to continue to load it, because the load itself stimulates healing, right? It stimulates our body.
Movement is medicine is our favorite phrase.
There's just science behind that, right? So if we can keep that going, then even though, yes, we might have an injury, then ultimately the loading and the things that you're doing that you love to do are actually going to help your healing, and instead of inhibit your healing. And that's a lot of what we, again, we'll try to figure out, because generally there's even though it doesn't necessarily make sense to the patient on how it's behaving, it's confusing and everything like that, there's generally a pattern. Right. And so what we're looking for is patterns, which again, particularly like for endurance athletes, particularly like even triathletes, there you get a really nice pattern recognition because you have things in flexed positions, like in the bike, you have things in extended positions, like swimming and running, and then you have impact that occurs with running that doesn't happen with swimming. So you really have you have a lot of clues along the way to really help figure out, okay, even if we can't do this one little thing over here, how can we maybe keep you in your training, and at least keep you moving?
Yeah. So it's like, hey, I'm not bothered at all when I'm riding my bike, but if I'm running, that impact is now causing issues, and you're like, okay, well that.
So
totally,
cool. Let's keep you on the bike while we're working on that.
Yeah.
The simplest way we start to look at it, and it really is more simpler for triathletes. We look at flexion sensitive issues. That's more seated. That's you're bending over. That's flexion versus extension. That's bending backwards or at least upright. That's going to be swimming and running. So a lot of times backs are more sensitized to one movement versus the other. So we start off. So if someone's listening and thinking, they can think to themselves, do I have a more flexion sensitive issue or a more extension sensitive issue? Flexion, of course, is, I'm okay. And the more I ride, the worse it gets. Or it's okay, but after I'm riding, man, it really bothers me. And the more I sit, the worse it gets. And in fact, when I get up and walk, when I get up and maybe go on a jog, it actually feels a little bit better. And those people are even told, oh, you have low back pain, stop moving, stop walking. Like, no, that's like the walking is the most therapeutic thing you can do. That's the movement is medicine. That's the medication they need to take is walking. Versus someone who has an extension sensitive thing. They're going to come in telling us, man, I'm fine on the bike. I might get a little stiff when I come out of it. But it's when I'm running for a while that starts to bother me. I start to stiffen up. Or if I've been, swimming lap after lap, I start to get tired. And afterwards, I feel like my back is really stiff. And if I can just sit down, it takes the pressure off. So that right there, we can put people as a starting point into two categories.
Gotcha.
Flexion sensitive, extension sensitive. Extension sensitive, we can start looking more at someone's joints on the backside, the facet joints. We can start looking at certain muscles that might be irritated from an extension sensitive thing.
Okay.
Flexion might be more some of the ligaments around the back, the discs. If they're having pain going into the leg, maybe now we're talking about some nerve root issues, but it still may not be.
Yeah.
But that we care more about a movement dysfunction versus someone coming and handing me an x-ray and saying, well, I was told I have an L4-5 degenerative disc disease. And I've got a disc bulge. Like this happens to us every single day. I have an L4-5 disc bulge. My name is Clay Jones, and I have an L4-5 disc bulge. Like people, like they wear a tag.
Nice to meet you, Clay.
Right, like that. They like once they are told that, it's like that's who I am. I've got a bad disc.
Yeah.
Right. I got
this is the life I now live with.
Yeah.
Right. I got a labral tear, like whatever it is. Right. But for the back issue, they're told they have an L4-5 disc bulge because they had back pain. They got an MRI, and it clearly shows that. I could pull up some research on my phone, and I might do that here in a second to show you, like most of us, I guarantee all four of us right now, 5 of us here have some disc bulges in our back. It's just part of human life. We call it wrinkles of the spine. But all of their pain is when they're running or swimming and has no problem on the bike. And so I'm thinking, I know your MRI says you have a disc bulge, but if you have an active sensitized disc that's causing your pain, you wouldn't be liking the bike. You'd actually love the run. And so they've been told to do treatments for their disc injury, but the disc is not the problem. That showed up on MRI, yes, but that's actually not the problem because that does not fit at all the pattern that they're walking in with and telling us about. And we see someone who has a flexion sensitive disc issue, they're going to hate bending over and touching their toes. I have people all the time who told they have an L4-5 disc bulge. I say, stand up, reach down, touch your toes. They touch their toes, no problem, have no fear, no pain. I'm like, excuse me, ma'am, your disc is fine. Like, I want to tell you right now, your disc is good.
Yeah.
Like, yes, I know you have a disc bulge, but you're fine. And they go, what, really?
It's not an issue.
It's not an issue. Like, it's just, it's there. Maybe you've injured yourself in the past. That's okay. Let's not worry about it. Let's actually get into what's actually causing pain during your activity. Not let's just look at this x-ray or just look at this MRI.
An image shows structure, not pain, right?
Exactly,
So what we're getting is a image of the structure inside. So you're gonna see little bits of wear and tear, and and there's study after study that looks at that. There's even there was one that they even did for runners on the lower leg, and like the incidence of Achilles degeneration and tendon tears and all this jazz. And these guys have no pain whatsoever. And they've done similar studies like for the low back, right? So of course there's changes to the structure underneath that happens from what we do. But ultimately it doesn't show pain. So it's important that imaging is important, but it's important that it fit a clinical picture. And it's really important that those two things match up, so that how your pain behaves and how it's presenting also matches up with what we're seeing on the image.
Yeah, I think a lot of people, like you're saying, get the imaging done and they say, "Oh, you have a problem."
Yeah.
But it doesn't match up.
Did you have that problem before?
It doesn't really match up with the
come to think of it, I do have a
actual
problem.
manifestation of that
it
problem.
takes time to ask those questions, go through the movements. If you don't do it, you have to make a quick assumption on imaging.
So in the case of the person who has the bulging disc, but the pain doesn't match what the image says, what is your go to after that?
Well, I always tell them I'm going to be respectful of what your imaging shows. We're not going to be cavalier and be like, your disc is completely fine. Listen, we're going to be respectful of it, but we're going to go into the movement-based exam. We're going to palpate. We're going to stretch. We're going to test muscles. We're just going to actually go into the exam and find out what they have. And if someone has an L4-5 disc, but they don't match a disc presentation, then I'm going to start looking at the things that they're showing up with. So we're going to look at their joints. We're going to look at their hips and say, I know you have an L4-5 disc issue, but when I go test out your hip, you have terrible hip extension and you have weakness in your psoas and in your glute muscles, and you don't know how to, you have poor impact ability with your hop test. I don't really care what your disc is. Your disc is fine. It's the fact that you're not moving well. And if we treat those things and fix that, movement is medicine, it's going to fix it. And you're going to be back to killing the races and feeling great. And we could take an MRI of your spine and you'll still have an L4-5 disc bulge. I could care less, because that's just part of living life. You're going to have this stuff, but you're fine because we'll treat the actual root causes.
So when should a person work through the pain versus
Never.
when is it important to say, all right, I need to go get this looked at?
Yeah.
Is there any set?
I mean, I think truly, I think with the low back in particular, I think it's good to get that looked at. I mean, either which way. I mean, for a lot of other issues of hey, I got a little ankle pain or something like that. I mean,
a nagging, a little nagging thing,
little things like that. I mean, they can go away just as fast as they came. But, I think that what I think we see a lot too is that if you did have an issue at the back and you didn't do anything about it, because it's such a central thing, a poorly rehabilitated issue there can really have a domino effect. So, I mean, I'm a big proponent of probably an early treatment for that. And I would say
early diagnosis and then treatment.
Go to a physical therapist first, though. I think I'm a big
We're physical
proponent
therapists. Go to PT first.
Obviously.
Well, there is a study that
goes
came
straight
out.
to surgery.
Yeah.
That's right. There's a study that came out, though, that looked at someone who has an acute episode of low back pain. If they go get an image first, instead of going and getting conservative care, the research shows that people who get imaging first, like an MRI, their disability time extends out than those who just go get conservative care first. Because you go get an MRI, and MRI is going to say something. An MRI will show something, and then people
often
get...
stalls
you can
time
find it.
too, right?
It stalls
it can
time.
take
We
2
get patients
weeks
that
to
all
get
the
into
time.
it, 3 weeks, 4 weeks.
In the meantime, okay, fine, go get your MRI in 10 days, but we can do so many movement is medicine. There's so many things you can do. But the point is, if you get imaging first, that can delay your actual recovery. But to the other question you said, we use the red, yellow, green light system as a decision-making model, meaning red light is pain that's not good. We need to do something about it. Yellow light is, that's just some soreness. You're going to have that. You're going to have some pain. A green light is you're good. Let's progress.
Yeah.
So to answer that question, I would say for the lower back, if I'm staying in a lot of yellow lights, meaning 2 out of 10 or 3 out of 10 to 5 out of 10 pain that's lasting for more than 24 hours, and it stays yellow in you're continuing your training and it's not going away, that's when I would definitely get that looked at sooner rather than later. If it's a red light that you're getting 6 out of 10 pain or more, you're wanting to take medicine, it's keeping you up at nighttime, you're adjusting the way you move. Like when you're running, you're limping, you're trying to get on the bike and you're like, I can't really drive that pedal. Every time I push hard, when I'm going up a hill or something, I'm feeling my back pain. Like, okay, you're starting to red light stuff. Get that looked at sooner rather than later.
Anything that's causing you to change your mechanics, whether it's on the bike or whether it's running, like that's a hard no, because our body is built in those patterns. So you start moving outside of those patterns, and then now all of a sudden it's really easy to kickstart another issue on top of what we've already got going on. So that's a hard
yellow lights that turn green, I don't worry about it. Like I was doing some heavier squat cleans today. And at the end of it, for like the hour afterwards, like, oh yeah, I can feel my back. It was a 3 or 4 out of 10, but I was trying to like PR. And so I expected some yellow light pains, but I'm moving normally. I'm sitting down normally today. I'm fine.
It's going to go away.
It's going to go away. If I feel this for the next 5 days, yellow light, okay, let's see what happens next time. If it keeps happening, I'm going to ask Dr. Sara over here to, hey, take a look at this.
Take a peek.
But yeah, like people are like, that's the thing with endurance sports, you're going to have pain. And pain does not mean damage. Pain is perceived threat from the brain. Pain has a lot more to do with you put pressure on a disc or pressure on a muscle. No, it's perceived threat. So it's okay if you're having some soreness, you're having some pain. You don't have to think to yourself, oh no, I'm damaging my body right now. No, your body's trying to build tolerance. It's building strength. So pain's okay as long as we go by that yellow light type.
Gotcha.
Pain. I don't mind if endurance athletes running and they tell me I have a 4 out of 10 pain. That's great. Let's stay where we are. Let's not try to increase my mileage, increase my speed. Let's be building strength first.
Right.
Yeah.
You
Let's
just
be
kind of
smart
hold
about
steady.
it.
Like you can, okay, I'm at a yellow light. Like we're okay. We're going to hold steady here and try to get that light to turn green. And then once you're in that kind of like, I mean, it's just nothing more than like a little awareness or a little whisper of it. Cool. Let's start to add on and progressively kind of overload that to get it stronger. But
that stress and recovery.
Exactly. But I think a lot of this is that, you also have to consider like the body is not like a set of tires, right? It's not like, this is kind of my analogy of, people are told that all the time. Oh, you're just wearing things down, right? You're just
strengthening.
You've got one set of tires for your life.
You got one set of tires, you're just wearing it down. But really the body is much more the engine, right? If you don't turn that engine on, if you don't get that fluid moving through the engine deteriorates. So if you just park that car and don't turn it back on, then you're going to deteriorate that engine way faster.
That battery's going dead for sure.
Exactly.
That ticker's gone.
Right.
We get people all the time. Now that we do treat a lot of higher level athletes, we get people ask me all the time, oh, I bet you see way more injuries than you used to. And I'm like, not really. I mean, yeah, we deal with injuries for sure. But the injuries that I saw or the pain presentations that I saw from people who were sedentary all the time, like, man, they have to deal with a lot more, like a much more uphill battle. Like that's a lot worse and a lot more chronic or hard to come out of than people are having some pains from doing, like actually using their body and using that engine. So we always want to, movement is medicine. That's our favorite phrase. We love when people want to stay active and push themselves, particularly with endurance type stuff. I think it's great.
Yeah, I think when you broke yourself.
I was just going to say, this reminds me of when Dr. Downing.
When you broke yourself and you were non weight bearing for like 10, 12 weeks.
Ooh, what'd you break?
My acetabulum.
Oh, yeah. That's a big one.
do
And
that?
it cracked through the pelvic root bone. It was not had some ribs.
trauma.
Is that a bike wreck?
Yeah, it was it wasn't even,
it
It was a
was
wreck. No, it was
a dumb one. I was going over a wooden bridge and dropped down an icy, like that backside was icy, and I just head of my femur just punched my hip socket. And for those not familiar with acetabulum, it's hip socket.
For a second. Yeah. Acetabulum. Yeah.
No, it was actually the other one. It was when I broke my clavicle and my ribs.
Oh,
and I was
right.
like, I'd been on my
the other
couch
one.
for a few days. And
was that the one where you broke the spirometry record?
yes.
Oh my
Yes, I
goodness.
did. It was my goal
What a
before
feat.
I left. Yeah. The spirometer,
those
Before he
Forces
left
away.
the med.
They're like, the only way you're getting out of here is if your lung capacity's good. And I was like, oh, my lung capacity's good.
Yeah.
Hand me that.
About
Give
to
me a
break
challenge.
records. Yeah. No, so I was chatting with Dr. Downing from St. Jude, and I was like, man, I've not gotten up in like 2 days. I've been on the couch, like just in a ton of pain. He's like, your body's meant to move. Get up and start walking around. I'm like,
Yeah.
You're like, what?
well, okay. Here I was feeling sorry for myself. And he's like, get up and move.
Pretty sure
Like,
he called you a sissy too.
well, we're not going to go into full details here. But it's the same thing you're saying. Each time you said that, I'm like, that's exactly.
Our body responds well to movement. Our heart is an amazing pump. And so if you're having an acute issue, swelling, inflammation, it's hanging you around. If someone has injured their back and like they really can't move very well. Like if they're sitting fine, can we get them on an arm bike or like a seated an assault bike type thing and just get their arms moving?
Yeah.
If they've injured their arms, can we get them on a bike and just pedal? Because you get your heart rate up, it just does wonders for your body when it comes to the healing aspect of it.
Well, and actually, like taking your body through a range of motion. The people that just sit all the time, you slowly start seeing those shoulders coming forward, and the number of issues we see with folks just from not doing strength training,
Right.
which we'll dive into before this turns into like a 3-hour long.
Right. To speak of some of those common things that we see and we identify, athletes who don't like to run, triathletes, and they maybe love to ride, and they become stiff in that more seated, flexed position, particularly in their mid back. When mid back gets stiff, then they have a heart, and then they sit all day, then in a job, they come home and they sit, like your body adapts to that position. So your hip flexors are going to get tight. Your glute muscles are going to have a hard time doing their job in the opposite direction. Your mid back can't straighten up. So you put a lot more stress on your lower back. So like one of the number one things we want to see our endurance athletes, particularly triathletes who ride, is you need to take your body through the opposite range of motions that you're doing when you're on the bike. Like you need to be on like doing a cobra, like a yoga move where you're on your stomach and you're pressing up, taking your back into extension, get on the foam roll, hit the mid back into extension, and then do some strengthening of your mid back. I've listened to you guys' podcasts about the strengthening. We love front squats, deadlifts, farmer's carries, anything where you're really engaging your full spinal muscles in a good postural position. Like that's the key, not just the stretches, but then strengthening is what really loads it. That's key
In that good position too,
in the
being
good position.
huge. Yeah.
And during the House of Pain, we always talk about spinal positions, kind of part of our mental checklist. And so you would believe, but for those of you listening, you would not believe the number of, so this year we had 100 cyclists in the program, and they don't all get online every night, but we'll do some like stretching and stuff afterwards.
Yeah.
And I always throw this test in just to see who can and cannot. But very few can like bend at the waist and not also cave in at their
mid back.
Mid back. Yeah. So like we talk about spinal control and the ability to kind of hold your upper body weight with your spinal muscles. They're meant to do that.
Yeah.
Right.
Good deadlift form.
And so many people who are even experienced cyclists cannot bend over without also giving way,
Collapsing,
mid-back.
Yeah.
It's incredible.
Pelvic positioning control. Can they hinge at the pelvis and be able to keep that? Like that's a big one for people. I'm sure that plays a lot in bike fits too, of like, trying to get their pelvis there. So
and even those people are the same ones that suffer from glute activation issues.
Yeah.
And end up.
And it's nothing more truly than probably a positional thing. You put any muscle in a weird, in a weird position, it can't fire that well. It's not like the muscle's incapable of it. It's there.
That's
it
what
can
we
do
see.
its thing, but
with Sarah, we were talking about beforehand, like people who are riding, they get off the bike and their body's so used to that position, they go try to run and they're still over in that flex position. And there's no way they're taking advantage of their posterior chain, their glute muscles, their hamstrings, even the calves, because they're staying too tight. Their body's they don't have that movement awareness or movement capability. And
that low back is their hinge point.
One of the big problems that I see weekly in bike fitting is that the position of the saddle is usually either tilted improperly to where their pelvis is tilted backwards versus forward. So your chest is down here, and now your seat is cueing your body to rotate your pelvis backwards. So there's like a disconnect
tailbone
between
under
your lower back and your mid back. And I mean, I can probably 80% of the time just retilt the saddle, and they're like, "Oh, that's
feels
way better."
Right.
No.
See, that's the kind of thing that's just such good information, because I'm going to go back to the point where people will go get an MRI. They'll say, "Oh, you have a disc issue," and you think, "Oh no, I got to stop riding." No, you just need to tilt your seat forward a few degrees and
just in too flexed of a position there for too long periods.
Find how the body moves and fix the movement patterns. That's what you got to focus on.
Well, the other side of that is that, like you said, like when you're sitting in a chair, I call it chair mode. I'm
in it.
Yeah, you're you are not only you rotate it back, so you're also putting the most pressure possible on your sit bones. And when a muscle takes like pressure and it's getting added stretch to it, it's not going to fire with a lot of force. You can shut a muscle down by pressing against it pretty hard. So if you're tilted, have that rearward tilt and you're just putting all that pressure on your sit bones, you're crushing your lower back and you're turning off your glutes. Yeah. It's the worst possible scenario for a bike position.
Yeah.
So we always try to get it to where the pelvis can tilt forward and kind of create a little bit more seamless transition from low back to mid back. But it also tilts you off your glutes. And so you have a little bit more balance between sit bones and pubic bones.
Yep.
And your glutes open up and they start working again. And
better position.
It's all good. You get more power. You get less back pain.
For us, also, just to the swing the pendulum the other direction, is those who, as we see a lot of athletes who are also type A, they want to do everything right. So even they want to sit well and have their posture is really good. And they tend to go into an arched, extended position. We see a lot of ladies with this if they have a background in gymnastics or Pilates, that kind of stuff. People who do yoga, and we tell them, you got to slouch. Because they keep their back too tilted, arch forwards, and now they're loading the muscles and joints on the backside in a way that actually sensitizes that. And so again, those are the ones who are going to say, I feel fine on the bike, but when I run, I'm like, man, you're running like you might be overcompensating, you're overarching. And even then, if you overarch, you're also now putting your position, your hips in a hard opportunity to work as well there too. So either way, the hips are going to have a hard time working if you're staying in one position too long.
And people's anatomy is different, right? Like your hips are shaped differently than mine, and all of ours are, right? So, different people, of course you do. People have naturally different postures, and neither one is good. Neither one is better or worse than the other one. They're just a little different. So it's if somebody is kind of stuck in a rut, in a movement rut, right? Of like, they're only just in this movement.
Cyclists are horrible about that.
Yeah. Then that's where you start to see that pattern. So you just gotta get out of that movement rut, tilt their tailbone a little bit this way. And all of a sudden, that changes the game.
And that's our main treatment. That's what,
I was
that's what
we're
looking
segue
at.
into
That's
that
what
treatment.
that's what we do.
That's what we do. It's like, that's where you have to listen to them, watch them, observe them, see what their patterns are, and do something a little bit different. And then we swing the pendulum a little bit different direction and say, okay, let's stay away from that for a little bit. Let's find ways that we keep you moving. If your hips are not activating well, let's start to get them kicking in. Let's start doing some strength training for those guys. If your spine is stiff into extension, let's start, we do a lot of manual hands-on work. We'll do a lot of mobilizations into extension. We get them doing self stuff at home. But then we know we can't just say, we can't keep the pendulum swung that direction. We have to bring it back to the middle. And then we start to strengthen their body to get back into those seated positions. Like, that's the thing that I think a lot of athletes are told who have pain bending forwards or have a disc issue is, don't ever do it again. And we're like, well, I'm going to do it because I like to ride. And so that's where we really implement strengthening into those positions. That's where we find the best treatment for them is movement is medicine. Stronger movement is the best medicine. That's my new favorite phrase. So if all you do is flexibility stuff, you're not going to maximize your body's potential to really heal and then maintain performance and longevity. You have to strengthen that. And particularly for people who have back issues, there's this myth that you got to be scared. You should be careful with lifting heavier stuff. And let's just stick with bridges and bird dogs and core exercises that just target the abs. We're like, yeah, that's great, but you kind of need the posterior chain too. So let's do some deadlifts. Like, we really got to strengthen you. Again, we're not going to be, we're not going to be cavalier about it. We got to be respectful of that healing process. But man, if you want to be an athlete, you got to be strength training. If you have back pain, you got to be deadlifting. The number one, they did a research study looking at what are the best core exercises that activate your core muscles. Deadlifting was the number one. Not a sit up, not a plank, not a crunch, not a bridge, not a bird dog, not a single leg bridge. All that stuff is great. But if you really want to get the maximal core in activation strength, it's a deadlift. So we work everybody towards that. And that teaches that movement pattern that you're talking about, Dale, because it brings in your upper body, your mid back, your core, your legs, just brings in everything.
So at what point are you like, okay, this person's, say a cyclist that comes in, they've got the rounded back, they're almost like most people are probably sitting right now if they're listening to this. At what point do you say, okay, we need to get your body mechanics, your mobility to a point where we can now have you doing deadlifts?
Day one. I mean, it depends on their pain.
Yeah.
But we're going to get people moving with those. We're going to get people strengthening as soon as possible. I'm not looking for perfect posture, perfect mechanics to load
Symptoms
it up.
guide that a lot of times,
Yeah.
right?
Gotcha.
Like,
Like,
so there's
Yeah.
sensitivity.
There's some people that are always going to have a stiff mid back that we're never, like, they've been there for too long, or maybe it's part of their genetics.
It's ingrained in their
It's
head.
ingrained,
Yeah.
and that's okay. But if you
anatomy.
then work on good mechanics, good hip hinging, and you ask them where they feel it, if they say, "Oh, it's my lower back," nope. We're going to make sure we tweak things. We'll change their form. We'll have them engage their feet a little bit differently. We'll change the posture so they say, "Oh yeah, I feel that in my hamstrings, my glutes." Like, we're not going to wait till someone is like this perfect specimen of posture and movement before we load it up with strengthening, because that's not how
You'll
it
never get
goes.
there.
No, and that's what I love. Like, when I went to the Ironman, we had athletes there, and I was watching all these athletes come in and off the bike and go on the run. I'm like, you have young and old, all different types of postures, all different types of mechanics and movement patterns. And I just love seeing the variety of the human race doing this amazing thing. So it doesn't have to, all it say is if someone's like, well, I'm just kind of a stiff guy and I'm going to have a hard time getting perfect posture, that's okay. But let's load you up and let's strengthen what we do have. And there's so many things you can do to strengthen and be safe and do it in the right way and feel it the right ways.
And that's the big thing. Progressive overload,
Yes,
right?
progressive,
You're not going to listen to this and go say, oh, well, let's throw 225 on the bar and let's smash
go.
some deadlifts.
No,
like,
exactly.
progressively getting to that point.
I think a lot of people, like, they'll get an injury, they'll go do physical therapy, and then what? They like never
God
get
bless, so much
beyond
clamshells, so many clamshells.
and the way I would put it is they never get beyond muscle re-education or that phase where you're getting the
They don't
muscles
get true
to turn
load.
back on. Maybe they're awake now, but they're going to fall right
still
back
weak.
asleep
Yeah,
exactly. If you don't give them some sort of
you don't change their
more
movement
load,
patterns,
more
you don't load
stimulus.
it.
I mean,
Particularly if you think
100%.
about endurance athletes, like a triathlete, a runner, what you get there is a whole lot of body weight, lightweight, right? Body weight, high rep, right? You do
Tons of reps.
Tons of reps,
Yeah.
thousands of reps, right? Of body weight, high rep, right? So if you think about balancing your training, right, then slow and heavy is the perfect balance for fast and light. And so if you've got all this fast and light over here, this slow and heavy can really be helpful at building your body's ability to take that fast and light over and over and over again, so it's like, it's really trying to help people, to kind of help find that balance. And to your point, take them past the initial, like, hey, we're going to get things moving. I mean, I'll do that. Like, it starts to say, like, if we're in kindergarten, we're in kindergarten, right? Like, that's where we are. But you do have to take things progressively overload them to get them back to those higher loads, because if they're gonna go on an 11-hour race, like, they got to be able to take that.
There's got to be some load bearing.
Yes.
Fatigue resistance.
but Sarah, I went and did that once, and I was sore for like 5 days, and I couldn't run or ride.
Yeah.
So why would I keep doing that?
it hurt my performance.
It is. You have to be strategic about how you're fitting that in, right? And I think that there's, like, to the strength training point, there's a strategic planning of where you maybe even put that into your training. Like, if you're in the midst of, like, hey, I'm in my peak season right here. No, that's not a great time for me to be like, let's get you in the gym 3 days a week, and I'm gonna really like crank
4
things
weeks
up
out
here
from your big event.
You'll love it.
So you've got to, I mean, when in my position, I kind of have to work around that a little bit, knowing people's time constraints, people's training constraints. And I truly think it goes back to understanding and relating to the person in general and knowing what their goals are from the start. And I've had very realistic conversations with athletes of like, hey, we're 4 weeks out of Boston, right? Like, we're not going to fix this in 4 weeks. We're in, damage control, mitigating, like, let's get you through this, like, once in a lifetime race.
Yeah, let's get to the start line.
And then once we're kind of on the back end of that, cool, that's where we can kind of come back to this stuff. But you have to lay the stage for that, or else the person doesn't know to do that, right? So it still has to be a big part of the conversation.
They're worried about it. So addressing that on the front end is huge. Like, okay, well, it's okay to work through this, and then we'll
Yeah. And it's helping people. That's where we really love that red, yellow, green light system.
Oh, for sure.
If someone's sore for 5 days, I'm like, okay, is it change? I mean, yes, you can't bend over and touch your toes because you're really sore in your hamstrings from going heavy, but that's going to clear it pretty quick. That was a yellow light. So it's progressive overloading and priming the body. It's the same way that I'm not going to tell myself, Clay, let's go run 15 miles right now. No, I'm not. If I did that, I might could get it done, but I'm going to be sore for a long, long time.
Yeah.
It's the same way of I'm not going to tell the athlete, hey, let's go lift heavy immediately day one. You start off easy, build your way up, build that tolerance, but your movement is medicine. Your body's strong and resilient. You need to keep lifting. That's okay. Be smart about it. And the more you do it, the more your body gets used to it. And then if you have good coaches who program that well, we find that if you go heavier with less reps, as opposed to killing yourself with tons of reps and lighter weight, that's going to make you more sore and kill your legs when you're trying to run versus just trying to be smart about your training and, maintain really good power, and not trying to go for PRs, but just maintaining that good strength if you're in peak, season.
I mean, I've found that the athletes that we can actually get to do the heavy lifting, we can keep them lifting heavy until like 4 weeks out, and then we kind of dial it back.
Yeah, it's part of their taper, essentially.
Once it's a part of their weekly programming, it doesn't affect them anymore. It's, you're going to be sore. We always say if you're new to it, there's going to be like a 6-week period where you're going to be pretty sore for a couple days afterwards. But we usually try to get people to do it in the off season when it doesn't matter.
After the goal race.
Yeah.
Take a few weeks off and then let's get in the
once
gym.
it's a part of their program, you can lift as heavy as you want. And it's, you might be a little sore for a day, but it's when you totally are doing nothing, no strength training for, months. And then you just want to jump right back into it. Pump the brakes.
Yeah.
Are there certain personality types where you're like, I'm probably going to be seeing this person again? Do you know it on the front end? They come in and
endurance.
You're welcome to
yeah, I was going to say,
if you're
they're trying to tell you about what's wrong with
personality.
them and how you should be, or how
all
they
of
should be
you
treated.
people.
But to your point, I would say I a lot of times will tell people I would prefer you to continue to lift heavy and less often. So I'll have people drop down to hey, just give me once a week.
Yep.
As opposed to it does not have to be more than that. I think that we have this misconception of it has to be, it has to be a lot more than that, but it really doesn't. So I'll have people drop down in frequency even, and that sort of thing. And that can a lot of times help with,
Yeah, it's nearly impossible to get triathletes to put the strength training in there.
It's hard.
So if they're going to do 1 day a week,
Yeah.
I try to get it to be the heavy day.
Yeah.
And if they're not going to do heavy lifting, I try to at least get them to do mobility work to where that's the opposite of what they're doing every day of the week.
Yeah.
At least give them some balance.
Make them move laterally.
Yeah. Right.
How many
little
times?
bit.
How many
straight
times
line
have we
movement.
had?
Do one side step. That's
How many
great.
times have we had endurance athletes go and try to play basketball or soccer just blow out
Knee
an
gone,
Achilles,
ankle gone, Achilles gone.
Just-
It's been at least 5,
Oh my gosh.
Yeah.
especially cyclists. Oh,
Yeah.
Yeah, one of the movement screens that we do with runners, athletes, just any endurance athlete includes movements on all planes.
Yeah.
And we look at their lateral plank endurance, and you can really you'll see people. We do a step down test, but even then, when you go on a single leg, which brings in the lateral component, you start seeing all these compensations and things are caving in. We do a single leg bridge, and you'll see their back arch, their hips drop. You're like, oh man, we need to spend more time and some strengthening that involves multiple planes. But that lateral plank test, you see people just really struggle. Give them a straight plank. Oh, they can go for a long time, particularly an endurance athlete. They're like, I got this.
Yeah.
Put them in a lateral plank, and they're like, oh my gosh, this is a lot harder than I thought. You have to shore up those things. And to bring it back to treating low back stuff, this is the stuff that fixes issues. I don't care about, I do care, I'm being heavily, I don't care about your x-ray, MRI, because I see it so much. It's like a passion of mine that hey, don't worry about it. You're going to be fine. Let's find your movement. Your body is strong. We can figure this out. But this is the therapy. That's the rehab you need to do to fix the issue and then get it to stay away long term. If you're going to keep pushing your body this way, you have to be doing that strength training, because the number one core exercise is a deadlift. You need, if you have back issues, like, I referenced it earlier, I had pretty decent back issues for 10, 12 years. Even as a PT, I was still dealing with it for a while. It's not until I actually got even more into my strength training in the past 5 years that my back issues really almost bottomed out to where I have no pain. I'm like, because now I'm actually freaking lifting heavier weights, and that's the best core thing that I've done. And it's given me confidence in my movements, which is the psychosocial aspect. My fear of my back is way less. And so then when I hurt my back recently, like, oh, fine, I'll figure this out. I'm going to get back to it. And going back in that strengthening, that's the real key to keep people being an endurance athlete until they die. This is the therapy that they need.
So recently I was told that I was having some bad back pain I have been very lucky I made sure that I haven't had very many injuries in the last 15 years that have sidelined me. I mean, maybe an easy, take a day easy, that sort of thing. And finally, like this last year, I had this back pain that pretty much prevented me from running, swimming, and I could ride okay and whatnot. So I ended up going get it checked out, and I was told I have some sort of, I can't even say the word.
Spondylolisthesis.
That's it. Exactly. Yeah. So I had a stress fracture as a kid.
A lot of people do.
And
it's way more common than people realize.
Yeah, that vertebrae is pushed forward, and that the one below and above it are kind of crunching down on it. And
let's use the ones above and below it have decreased space.
Yeah, okay. It's
not crunching.
They're killing me. No, but my first my first thought was I better get back to lifting heavy, or this is going to turn into a worse issue.
Yes.
So the last few months I've made sure that I'm back in the gym doing front squats, doing some deadlifting and heavier lifting, just to make sure that the structure is as strong as possible.
That's awesome, Dale. Like, great study that was done, probably a few decades ago. The number one predictor of chronic low back pain, they looked at MRIs, X-rays, how big is the disc bulge, how big is the nerve pinch, how tight are the muscles. The number one predictor of chronic low back pain is the person's belief about themselves. If they believe that they are weak and that they are fragile and that their spine is damaged and they're going to die, they're catastrophizing. If they catastrophize, those are the people that have chronic low back pain.
Straight off the pelvis.
Yeah, my L4-5 is now slip forwards, and I'm going to get paralyzed. I better not move.
Yeah,
that's the number one predictor of chronic low back pain. So just hearing you say, "Oh man, I got to get strong. I've got to help my body," like that right there tells me, "Oh, okay." Someone coming in and tells me that, like, we can work with this. Yeah. Someone coming in and telling me who catastrophizes, even if their X-rays or MRIs were clean and show nothing, I'm thinking to myself, ooh, this is going to take longer because I have to treat those psychosocial components for low back pain versus someone who says, let's get stronger. Like, yes, great.
Yeah.
To that end, like, I think if you're going to treat endurance athletes, like, one thing that has got to be on your radar is a bone stress injury. Because it could have, if somebody had picked it up in you, right? Or like, if you got somebody that's recognized like, oh, okay, I think that this is what you're dealing with, right? And you treat that well on the front end, instead of that just going untreated of, oh, it's just a tendon, oh, it's just this, oh, it's just that. And then they're continuing to train. Like a bone stress injury is one of those things that will change the game there a little bit. It's probably, for me, like probably one of the most common of like, if I'm dealing with that, everything else is kind of in this bucket over here. And then a bone stress
That's
injury
when you got to rest.
Is over here. And you have to know when to recognize that. And those can,
what are some of the signs of that?
So what is the that point where you kind of know that it's,
that's where you need imaging, that kind of stuff.
Yeah.
Well, I think, I'll let you kind of speak to a pars fracture in particular, like, which is the spinal, like vertebra fracture.
Okay.
I'll let you speak to that.
Pars fractures are really going to happen in your high school athletes. You see them happen in college.
Yeah.
Me
Typically
too.
young adolescent.
When I was in Seattle, this was like the main patient that I see. We specialize in that. So middle school, high school, sometimes elementary, but it's a weight-bearing sensitivity. Like all stress fractures, it's a weight-bearing sensitivity. those athletes are going to have pain with, particularly the pars. It's a certain aspect of the vertebrae that comes under stress as your body is growing. So you see it when girls are going through puberty, so a little bit earlier, and then versus when boys are going through puberty, they start puberty a little later. So that is going to be one of the main signs. It can happen when you're 17, 18, 19. It just does, but it's not as often. Most times when you pick it up as a 19-year-old or 22-year-old, they probably had that when they were younger. They just didn't realize that's what was going on.
Gotcha.
Yeah.
But it's running, jumping, twisting. I saw it a lot in our soccer players, football, runners. They say, it's when I go to run, the more I run, the worse it gets. My back really locks up on me. But it's a weight bearing sensitivity. How do you feel sitting? Well, at first it starts off with, they don't mind sitting. It's fine. It's more when they've been active. And then you take them, and for the pars in particular, it has to do with, I can get real clinical here, but it's more an extension based thing. If they've been backwards, that's going to cause that pain. Yeah. Flexion feels fine unless they've been going on for a while and gets really irritated, then everything kind of hurts. They're going to be tender to palpation sometimes, not always. Rotation-based stress tests you can do their spine can be painful. And that's the main things I'm looking for.
But stress and stress fractures, including one of the most common that I'll pick up is just hip stress fractures.
Yeah.
That's more common as you get older.
That's probably at least
Well,
within
in the endurance world, is that going to be?
And that can refer to the lower back, butt, hip area more if it's a hip thing.
So it's not going to be as much kind of, in the lower back, in all likelihood, but,
Gotcha.
But you can have a sacral, stress fracture as well.
Yeah.
Those are, it's not as common. That's not, it has to be on your radar. And truthfully, I think you just have to understand how the system works, because a bone stress injury like that it's not just a mechanical thing, right? It's a system problem. So it has to do with hormones. It has to do with nutrition. It has to do with sleep. So you have all of those other factors at play. But as a practitioner of endurance athletes, you have to be asking about all of those factors. You have to be, because that's a lot of the diagnosis of that, it can look very similar to other things. It can look like a tendon. It can look like a muscle. You have to ask about those factors, because those are the things that are going to make you go like, oh, that really fits this stress injury pattern. And if you've got enough that makes you think that, then it's an appropriate time for imaging.
That's the one where a lot of times x-rays miss that stuff.
Yeah.
So people come and say, well, I've had an x-ray of my hips and it was fine. I'm like, well, that's not going to show it. That's not going to show that. You really need something specific that a physician will know the ins and outs of that. What's an MRI or a CT scan? They'll be able to really tease out the exact image that's needed there. For physical therapists, that's not our scope. We say, hey, this just smells, sounds, looks like we're doing some type of stress injury. Yeah. This is the one thing that we need to actually rest if that's what's going on.
Yeah. And they still need PT, but it's going to change. It's going to change what I do.
Exactly.
Which means I need to know if that's what's there causing that issue. Yeah, gotcha. And there are areas, where stress fractures are less of a risk, right? Like there are low risk stress fractures. There are high risk stress fractures. So, anything that's on that higher risk side, so sacral, hip, certain areas of the foot and the ankle, it's the stuff you don't want to miss that, because you're potentially, that person could end up in a really bad situation. Yeah. So that should be on your radar, and you should be, sending out very quickly.
Thankfully for sacral stress fractures, rare. Pars, stress fractures of the spine, rare. When you get older, you're going to start irritating other structures first before you get to that. Like in your case, you might have had a stress fracture. You would have had that when you were younger, but now your body may have been sensitized to when you started having back pain recently, but it probably wasn't the bone that was causing the pain. It was something near that, the facet joint. Those are the things that are going to be the source of pain at that point.
Yeah, I don't know. I think I was like 14 or 15 when it happened.
Yeah, 15.
All I did was lift heavy back then. I've been lifting heavy since I was like 8th grade. So so I probably cracked it lifting heavy, and then didn't do much about it. Yep. And then I've always been sensitive to back extension.
Yeah, when you said running and swimming, not that bad on the bike. Oh, there's an extension sensitive issue.
Yeah.
Like doing a cobra stretch.
Yeah.
Right.
Not your favorite.
Very little mobility there.
Yeah. Gotcha.
So, do you mean to do the cobra right now? Yeah. Only if I can do the hissing cobra.
All right. So let's. I mean, I think we've kind of prevention wise probably pretty similar to the treatment side of
Should
things,
we,
right?
should we
Like
get the horse out?
lifting? Yeah, exactly.
Be
Lifting weights. We should all be lifting weights. We should be going heavier. The bodies are meant to be loaded.
Yes.
For those that aren't, this would be about the 14th time we've really tried to stress the importance of strength training for endurance
it's
athletes.
a common myth out there that has still not been put to bed.
Yeah.
Like
I'm going to get too big and bulky. We hear that one.
Oh,
It's
yeah,
like,
right. We hear that too. I have people
With the
tell me all
calories
the
you're burning?
yeah,
Okay.
exactly.
time. Oh, like it's so good for you.
Where can folks find you guys?
We are on Broad. That's where our clinic is at, 2637 Broad. You can find us online at www.901pt.com, Instagram 901pt. That's how people can get in touch with us.
All up on that Insta.
We have an active social media. My wife's in charge of that. She runs that, does an amazing job. So we have a lot of helpful tips, things that people can go to as resources on our YouTube page too. We have that. So yeah, that's how people can find us.
There's a little humor there too. I catch every once in a while a little sense of humor there. It's always nice to see. Well, we appreciate you guys kind of giving your
thanks for having
time
us.
up
Yeah, thank y'all so much.
and chatting about this. I mean, there are endless topics in the world of injury and prevention of injury. So we appreciate you guys
Absolutely.
hanging out with us today, and we appreciate everyone hanging out, listening, watching, and we'll catch you guys next time. Adios.
Peace.